Geneva University Hospital is the largest hospital in Switzerland and an international reference center. Our philosophy is to place the patients first. It's not just a slogan, it's important to all of us. In this perspective, in 2017, we have inaugurated a new building for in-house patients, offering modern equipment and comfortable rooms. Our institution's urology division is the fastest growing clinic of the Department of Surgery. It provides specialized care with state-of-the-art technology for minimally invasive treatment. Its chairman, Professor Iselin, and his team have pioneered laparoscopic surgery. They have developed an active robotic surgery program in our institution. I'm extremely proud to have not only great professionals, but great teams taking care of our patients.
We have really tried to intensify the individual management of the patient. Urology is a subspecialty which digs deep inside the intimacy of the patients, much more than other specialties. So it is really important to develop that sort of confidence relationship with the patient.
Prostate cancer is a particular disease because it touches many aspects of man's health. It is not just a cancer that can be life-threatening, but it's also a disease that has effects on functional aspects of the man's body, in particular urinary continence and also sexual potency. It's a disease that is also complex because it has many different forms and manifestations. It can be a small, localized disease that only needs surveillance, and it can progress up to a stage where it is generalized and needs systemic treatment.
The developments are evident. For instance, if you look at the number of doctors working in the division, it has more than doubled over the last 10 years. We have also increased by a factor of 4 the number of radical prostatectomies, which is the removal of the prostate we do with robotics. And for instance, from the statistics of last year, we learned that we had increased the operative load by 10% comparing to the year before.
We are very proud to have obtained in 2014 a quality label from the German Cancer Society. And we have been, since then, over the past 5 years, a certified prostate cancer center. We were the first certified prostate cancer center in Western Switzerland. We achieve highest quality standards in surgical care, in diagnostic care, and in the treatment overall of our patients. This label does not only cover technical aspects of care, but also patient satisfaction, satisfaction of the people working in the center. The certification covers all aspects of our center.
We are here in the robotic operating room. You can see the robot behind me with its arms that are piloted by the surgeon at the console. Now, what happens in this room, of course, is most importantly the operation, but also, just as importantly, we have the possibility to record many of the characteristics of the operation. Every part of the operation is filmed, of course, and this is then stored with the data of the patient, and this enables us to review all the cases and make sure quality is there, present at every level, and this of course enables us after that to be certified by the German Cancer Society.
What brings us here to the operating theater is a long process. We have not randomly chosen to operate this man. We have worked up in detail his file. We've had a multidisciplinary meeting regrouping many specialists, examining every different detail of his MRI, his biopsies, his quality of life. And this is the culmination of a long process and a long workup of this particular situation. We have also, on a more human level, discussed with the patient. We have counseled him about the operation, about its effects on his quality of life, and you have answered questions also that his family might have.
I choose this hospital and this country because Switzerland is known for high quality medicine and to have access to all the latest technology. This department is really great for training because they have different urologists who are specialized in all the urologist domains. I mean functional diseases, kidney diseases, oncology, and they have very solid and wide expertise.
Our unit is working very closely with the urology division in developing new drugs and new medication for patients with advanced solid malignancies in the field of urology, such as prostate cancer, bladder cancer, or renal cancer, for example.
When we make the diagnosis of cancer of prostate, my first reaction was a little fear, because my father was dying of the same illness. So first reaction was difficult. But after that, I have the possibility to consult here in the Hospital Cantonal, and have the possibility to see several persons, and I will be able to go on and with good reaction from all the staff.
The vision for the future is that, of course, technology will help us improve robotics and minimal invasive surgery. All this should decrease the burden of treatments for the patients. And that, of course, is for us a never-ending goal, because we want to be as less invasive as possible for the patients.